Hello, everyone, and welcome to another session on PhysioTV. Today, we are here for a segment of Road Less Traveled, where we get to know an eminent personality from the field of physiotherapy. I, Dr. Rucha Rayas, Assistant Professor here at Cardiorespiratory Physiotherapy Department of Sancheti Institute College of Physiotherapy, Pune, extend a warm welcome to all our viewers. I take immense pleasure in introducing a well-known personality from the field of cardiorespiratory physiotherapy, none other than Dr. Raziya Nagarwala, ma'am. Ma'am recently retired from the post of Professor and Head of Department of Cardiovascular and Respiratory Physiotherapy here at Sancheti Institute College of Physiotherapy, Pune. She's an amazing clinician and ever more enthusiastic academician in the field since several years. We will definitely get to know more about ma'am as we go through this interview. So I'll not spend a lot of time in introducing her. We'll listen to her experiences from ma'am itself. And let's extend a warm welcome to ma'am once again and begin our journey with Dr. Nagarwala on the road less traveled. So welcome, Raziya ma'am.
Thank you, Rucha, for such a kind word.
So, ma'am, as we start on the road less traveled, basically, I want to begin by asking you a little bit about what was your life like before you got into physiotherapy. So, can you tell us a little bit about where you were born, how you spent your childhood?
Well, I'm from Mumbai, a Pakka Mumbaiite, where I spent my childhood, my schooling, my 11th, 12th, and then, of course, my physiotherapy I did from the eminent St. GS Medical College, KM Hospital, Mumbai. And that is where I started beginning my career in physiotherapy.
Okay. All right. So, your introduction to the field of physiotherapy, would you say that it was planned, meaning you were always inclined towards healthcare, or was it by chance?
No, because see, the physiotherapy field, the awareness at that time was not there. Like I get into the physiotherapy in 1975, 76. So during that time, the physiotherapy was not so well known. Yeah, I think that was the time just started. I still remember Miss Dastur, our pioneer, where you can call a mother of physiotherapy. She was there on the Doordarshan giving the insight of physiotherapy, the awareness. So we can say that we at present in 2023, we are still talking about the awareness. So the awareness she had started during that time. And okay, I was not inclined. It was just there was an interview, so I heard it, but nothing I was knowing about the physiotherapy. As usual, our first choice is medicine. And when I passed out, I am the person who has passed out 10 plus 2 plus 3, the first batch of 10 plus 2 plus 3. Before that, it was 11. So when I passed out during the 74, 75, during the same time, there was a 11th standard which was called metric or SSC. There was a parallel batch. So there was a competition, the 10th standard, and those who have passed 11th standard. Hence, as usual, we don't have a much planning in our system. So both the batches were there who were going for the professional courses. Hence, the seats were divided between those who passed out 11th and with that, I mean, in that was interns, I think intermediate it was called. And for us, those who passed out 12th, right? So the seats were divided, hence there was lots of chaos. And hence, how it was, then the seats were divided, so it was less. And then they increased the seat after 6 months. So there was again another batch when I was admitted. I was lucky one to get admission in the first round, only first round of what physiotherapy during that time. And then after 6 months, because of all these uh, rounds, they increased the seats, and then there was another batch parallel 6 months later. So we had two batches.
Okay.
There was not batch one and batch two, but there was another batch after 6 months who appeared with the exam after 6 months only. So
Okay.
when I passed out my 12th standard, of course, as we say, that the choice was to go for the medicine, MBBS, but then I didn't get it. And during that time, when I went to get the form, fill up the form for the medical, people were taking another form also. So by chance, I just took the form. And fortunately, and then I got my admission in physiotherapy. So
Okay.
that's how I went into physiotherapy without knowing much about physiotherapy.
Okay.
Like
So
today,
it
I
was a
think
bit of
the
luck by
awareness is
chance.
much more physiotherapy.
Right. Okay. So it was a little bit of luck by chance.
Yes. But then,
So
yes, I started liking it.
good. So how was your experience at KEM during your graduation? So it was a 2-year course, 3-year course back then.
No, that I say that we were the first batch of introduced 3 years course. So we were the first batch of 10 plus 2 plus 3. Hence, all the new subjects were introduced, like life science and biostatistic and medical electronics and all that, other psychology. What we have at present, I think, in university courses, but that time it was 10 plus, sorry, it was 2 years course. So these subjects were not there. Hence, when these new subjects were introduced, there was a little bit of, they were not getting the teachers because planning was not, maybe there was not much of planning. So, as and when we got the teachers, the subjects were introduced, and we appeared for the exam also. I think every 6 months we were appearing for some exam because that's university was the subject, like, maybe it was the previous year of the first year of the subject, but since the topic were not covered and the subject were not introduced, we appeared the exam afterwards when the topic was done. So, it was like a exam in a bit. So it was difficult, yeah, because we were the first batch and hence it was exam maybe every 6 months, every 3 months, some top subjects were introduced and we were appearing for the exam, university exams.
Right. Right. So we spoke about your experience of graduation from KEM, but can you tell us a little bit about how you developed the love for cardiorespiratory?
Well, after I passed out, my first job was in KM Hospital as a clinician, and I was posted in CVTS. So in KM, CVTS has a cardiac surgery, cardiac unit, and respiratory unit. So I was posted as a freshly passed out physiotherapist into a respiratory and cardiac unit. So this was my first posting as a cardiorespiratory, where you can say the seed was put there only. And that's how I started working and I developed my interest because I would be thankful. I really extend my thanks to my seniors who were there working during that time, who supported me, taught me, because when you go into the ICU, it's always anxiety. There is anxiety, and they were to guide me, and that's how I developed my interest in cardiorespiratory. So my first clinical posting where I started, and I think again by default, you are given a clinical posting in rotation during your students and internship. And mostly majority of the time, I used to get my rotation in CBTS. So that's how I was pushed into the cardiorespiratory.
So it was
But yeah,
fate.
I'm thankful.
Fate.
I'm
You were
thankful.
meant to. be posted at cardiorespiratory.
Cardiorespiratory therapist, yes.
Okay, so you said that you started off your clinical work from KEM, and then after KEM, where else did you work?
Yeah, I got married, and yes, my husband was that time working in Kuwait, so I moved to Kuwait, and that experience was also very lovely. I was working in the OPD setup, means it was a government hospital, and working in the OPD, so you treat musculoskeletal neuro patients, mixed up even pediatrics and all. And there again, it was there that in rotation in the evening, we were given a duty in the ICU.
So again,
So
by fate.
again, it was by default that in rotation, every therapist had to go to ICU in the evening duty because our working hours was only in the morning. So evening, to cover up the evening duty, we were given a rotationary ICU duty. And that's how I had a hands on my ICU patients.
So for how long were you practicing in the Middle East, and how do you think that physiotherapy there is different from that in India?
I was there almost for 5 to 7 years. Yeah, from 83 to 1901. The experience was good there also. It was, yeah, they have a better infrastructures. That's the how I would say. Number of the patients were really good. So a good experience. There also there was not much interference from the doctors. So you can plan your own treatment. Yeah, only thing is there where I was working in Kuwait, the female has to be treated by the female therapist and male by a male.
Yeah.
So that was the only thing. Otherwise, number of the patients were good. I had worked also in the IPD, Ortho IPD,
Hmm.
orthopedic were in rotation. I was switched to that hospital. Elbow surgeries were done. So of course, yeah, lower limb CPM was there only, but during that time they had this shoulder CPM and elbow CPM and all. So yes, infrastructure wise, yes, they had a good infrastructures. They had the hydrotherapy where we had a hydrotherapy also. So we used to treat the patient in under the water in hydrotherapy also.
Okay.
So totally a good experience.
Okay. And then how come from the clinical field you landed up in academics after that?
Well, after that, I started working when I was in Pune, working with Ruby Hole Clinic, and the most stalwart of the physiotherapy, Dr. Mrs. Mirjankar. She was the HOD of the Ruby Hole Clinic, and that time Sancheti started with the physiotherapy in 1995, and that time they were needing the teachers. So ma'am introduced me that, and she asked me, why don't you go as a taking the lectures as a honorary? So in the beginning, yes, when they started in 1995, I was coming only to take the lectures. But then I started, I was not very sure whether I'll be able to do this justification of teaching because I had never been as an academician because all this time I was a clinician for last almost say maybe 15 years or that time. So when I started, I liked it. I started liking teaching, and then from then in 96 June I started coming as a took up a job in Sancheti Institute College of Physiotherapy. And that's how I became an academician from the clinician.
Okay. So from your experiences in Sancheti Institute, because I think you were there since the very beginning of
Yeah, from the time
College
of
Physiotherapy.
till I retired, yes, almost 27 years.
Right, right. So you have seen physiotherapy, I mean, the college grow from its very inception till date. So we have a few photographs which I would like to share with our viewers. And then you can tell us more about. Right. So,
Yeah, this is my batch, 8081 batch, where we passed out. Yes, of fond memories. And thanks to our internet and WhatsApp, that now we are all that on the WhatsApp group also. So we had only one boy, if you can see him, Uday
yeah.
Kulkarni, but unfortunately, yeah, he is no more. He died in an accident. And yes, we are all there with Ms. Dastur. So this is my college photograph. And this was, I think, that was a farewell, the last farewell party.
Okay. Okay. And we have a picture of the first batch.
1995 batch, first batch of our Sancheti. When we started with a diploma. So we had two batches for diploma. And then 95 was a diploma admitted. Then 96 was again a diploma. And 97 was from under Pune University.
Okay.
And then it started with a MUHS. So though it was a diploma course, thanks to Dr. KHS Sancheti sir, who persuaded through the Pune University. And this diploma batches, they had an opportunity to get the degree by doing a 1 year course. And they got what we call it as a bridge course, and they got converted into a degree. So this
Right.
is my 1995 batch. Sabnis madam is there in the photograph, the first principal of the college. So a fond memory. Some of the students are still in contact with me. That's how we have built up the connection and the relation. Here you see on the right side is this other first batch of MPT. MPT we started in 2004, and that was also under Pune University. And these are our first batch of MPT who passed out.
Okay. It is
Now
nice to
Jayesh
see
is the
how
principal in one of
your
the
students
Gujarat
are so
University.
fond of you till date. Right. So this, I think, is a very special moment that
Yes.
has been captured. This is the inauguration of physiotherapy department at Kamla Nehru
Kamla
Hospital.
Nehru Hospital, yeah.
So can you tell us a
Because
little
I
bit
think
about this?
we had this with Kamla Nehru Hospital from 96, 97 only. And that time we were in a very small room on the ground floor, and we started with the physiotherapy. They had some equipment. Then from our institute, we took some institute, and that's how we started with giving service of physiotherapy to the Kamla Nehru Hospital, which is a municipal corporation hospital. And after that, they gave us what at present we are. They gave us a big place, and this was the inauguration. You see Dr. KHS Sancheti sir, and of course Rairika madam, the principal of the college at that time, is also seen.
Yes. Right. So, along with this, you definitely have several fond memories with many of your colleagues who have been throughout your journey in Sancheti, and some who have been there with you for a few years. We have pictures with some of your colleagues. Can you tell us a little
Yes.
about
Yeah.
who they are and how they have
Yeah.
influenced your journey here?
Wow. This is in the middle, this photograph, you have a Gupte sir. He was the, what you say, administrator at that time of the physiotherapy. Yeah, we had a principal, Sabnis madam, but Gupte sir was the administrative person who was looking after the everything like admissions and other working of the institute. Then this is Mirjankar madam I was just talking about. A very I have a very fond memory, because I would say that my other whatever the respiratory I have learned my respiratory physiotherapy. I would give her the credit, Mirjankar madam, because she had worked in the chest, on the chest hospital for years, and then she got retired from there. So I think she has worked for 40, 45 years till she retired in on chest hospital. So she was like a motherly figure to me, Mirjankar madam. And then we have Vasanti Joshi
Yes.
madam. She was my colleague, of course, and we were classmates. We passed out our physiotherapy together. So if you see in that old photograph of my 1980-81, that time Vasanti is there in that photograph also.
Okay.
Then you have a Ronika madam. Now she is a principal at Rangunwala, and Komodi, she is at present in USA. So, and this is with some of my students. Nilima madam is there in this.
Yes.
This is again the colleagues who were there with me. Kulkarni sir is there in this photograph, of course. Vivek Kulkarni sir, who
Yes.
was, I would say, the most methodological teacher. And yes, Mirjankar madam used to call fondly him scientist. So no wonder why she used to call him a scientist, because he is the most methodological person. I think you also know him. You also had a chance to work with him.
Yes.
So this is the time when we were there.
So, ma'am,
I
just for
think this
our
was
viewers who may be new to these eminent personalities in the field, people who don't know who all are in the photograph, can you just name everyone in line who is there in the left photograph?
the below one. Yeah, Joshi madam, me, and then Sabnis madam. Behind
Okay.
Sabnis madam is Kulkarni sir.
Hmm.
This is Ronika madam.
Yes.
I think Ronika, no, I can't see because this, your 1 minute.
Oh, okay. 1 minute.
Yeah, Ronika, Nilima Bedekar madam.
Yes.
Yeah, I was fortunate to work with her also for such a long time. The most friendly and the knowledgeable person, I would say. I had
Hmm.
the chance to work with her.
Hmm.
Then this is Pallavi. This is Pallavi. I think she she's in Mumbai. I'm not very sure. She is in USA.
Okay.
I would again like to add here that Sabnis madam, who was a principal for such a long time, and she was a very strong lady. And yes, she was the one who has brought the institute to that level. She was really a nice teacher, nice administrator, very good administrator, and really she had the insight to bring the institute up. And with her as a principal, she brought the institute to certain level higher. From there, then Rairikar madam and Kulkarni sir took up, and now we have a Shimpi sir as a principal.
Yes.
And of
And
course, backbone is always there,
ma'am,
Nilima madam.
all are there in the other photograph, the one on top.
Yes. Yeah, here on the left side is the Dr. Mrs. Mirjankar madam.
Hmm.
As I told you, she is the one who was working for a long, almost for 40, 42 years in On-Chase Hospital. And then she was the HOD of Ruby Hall Hospital.
Okay.
Sabnis madam,
Hmm.
me, myself, Gupte sir, who was I said, he was the one who was looking after the administrative work of the physiotherapy, and everything was under him.
Yes.
Ronika madam, Ronika Agarwal madam, who is now the principal of Rangunwala College. Joshi madam,
Hmm.
and Kaumudi. Kaumudi is now in USA.
Okay. Okay.
I think this must be 96, 97.
Okay.
And this may be around 97, 98, 99 photograph, the second one.
Okay. So moving on to some few more photographs. These are a little bit more recent. So I think
Yes.
on the left, in the upper photograph, again there is Joshi ma'am, Shimpi sir, Kulkarni
Shilpi sir,
sir, Bedekar ma'am. Then there is
Dr. Gajanan.
Yes.
Kalera. I think everyone knows him. He's a very good clinician, a very good neurotherapist. Sabnis Madam and Simi Madam, who is
Yes.
now principal at the Suryadat Physiotherapy College.
Right.
This is where recently we all met outside. Sabnis Madam, Kulkarni sir, myself, and Nilima Madam,
Yes.
the seniors teachers. We
So
just had a one
throughout
meet.
Sancheti, your experience here, you have worked with several different principals, right?
Yes.
So, how has your experience been working with them?
Well, everyone is different in their own. Everyone has some good points. So, as I say, that Sabnis Madam, who took up as a challenge, who's, when the physiotherapy college was just in the starting in a baby format, and she brought it to that standard. So, she was a very good administrator. As I say, Kulkarni sir, the most methodological person. And I would say that support to this Raidikar madam and all, the support was there all the time from the senior teacher like Joshi madam and I would say Nilima madam. Nilima madam, though has never taken up the principal post by herself, she was working sometimes as a principal and all, but she is a really good administrator and she knows what you say insight of the work and she knows MUHS much better, the admission process, all the process, the PG admission, UG admission. So I would say Nilima madam is always there as a backbone to all these principles.
Okay. Now, after this, we have some more recent photographs. These I specifically picked out because I feel that they highlight a little bit more about all the different roles that you have played
Yes.
throughout your professional journey. We can see everyone in masks here. That was the time
Yes,
around
this is
COVID.
a COVID time.
Yes, where you
So
were
though there
you
was a
have played.
COVID, we never stopped celebrating. We were working on Zoom during that time. That was again another experience with us
Yes,
that we had to take lectures and even not only lectures, we have taken a practical skill training also on the video and showing them the skill and showing everything on video. And we had asked the student to send us back the videos of how they practice at home.
right.
So a different experience. Yeah, but we never stop enjoying. So yes, working becomes more enjoyable when you can have a good colleagues working with you and a good environment where you can enjoy, and that's the most important part of working. This is up, the up one is the interns or taking ceremony. I think this was a year back or 2 years back. This was a small I was given a certificate for appreciation for my work from Manisha madam and Kulkarni sir. And yes, how can we forget our Zoom Scientifica online. So this is our Scientifica.
So over
The
a period of
Scientifica will
time now,
always remain close to all the people who have worked in Sancheti. It will be always close to our heart.
so over a period of time, there have been so many challenges. COVID just being one of them, even before,
Yes.
even after. But you have always risen to the challenge and given suggestions to overcome such obstacles. And definitely, students, colleagues, other faculties, we all have had something or the other to learn from you. So wishing much more growth to you professionally as well as personally. In your professional life, there was one such highlight event, I think, which was meeting Professor Dr. Elizabeth Dean. So, can you tell us something
Elizabeth
about
Dean, the
how
one.
this went?
Well, this was I went to the workshop, attended the workshop in Bangalore, done by the Manipal University in Bangalore. And she was the one who took the course for 2 years. And really, I appreciate her energy at this age to continuously take 2 days workshop alone for 8 hours every day, 8 to 10 hours, standing alone, speaking alone. Wow, I salute her energy. And of course, I have the most my favorite, I would say, student Abhijit, Dr. Abhijit Divte, who is a medical superintendent. Oh no, he's a director of Dr. V.K. Patil Hospital. So he has done master in physiotherapy in cardiorespiratory under me. So I feel very proud of always introducing him.
You are very well known for your hands-on skills, and patients remember you and stay in touch with you for several years. I personally have also seen patients meet you after many, many years of a gap, and they still feel like you are a part of their family. So, any special patient interaction or experience of treating a patient that you would like to share with us?
Many patients whom I treated in my early days, and like I think some days back only when Dinesh told me one patient came in KNH and asked him, "Okay, where is that therapist?" He did not know my name, but he told about that she was a Muslim lady and all. And Dinesh immediately called Raziya Nagarwala madam and he said yes. So this is I felt yes, the patients come back after years and they remember you. That's you feel blessed, you feel happy, you feel happy that you have touched somebody's life. Maybe I have given some treatment where he felt good. Yeah, there was a time when we were taking a COPD COPD day celebration. If you remember, Lucha in KNH, there was a father and a daughter who were coming, and they told me that I was treating the mother and the father for some years when I was I was going to KNH for my teaching, clinical teaching and all.
Right.
So this is how they are in touch. So many patients are today also in touch with us. And that's you really feel happy and blessed.
Correct. So many years of dedicated service towards thousands, millions of patients. There are so many lives that you have touched, and it is definitely worth appreciation. Along with several awards and accolades, I think one of the most recent and prestigious ones was when you were felicitated by the Rotary Club of Pune
Yes.
Horizon, and
Yeah.
that was for your consistent good work in healthcare and selfless commitment towards humanity. So how do you feel about receiving this?
That's what I just told you. Okay, you feel blessed and you feel happy that when you get the recognition, of course, it's mean a lot that you people recognize you for your service to the society, and that's really that appreciation makes you happy.
Good. I'm very happy to hear about your personal feelings about how so many patients are appreciative of you, but patients are just one part of the many lives that you have touched. I think students are also there, and you have taught so many generations. I think from the inception of the college till date, meaning more than 25 years, is the
Yes.
time that you have spent here being a physiotherapy teacher. So
UG and PG.
yes, UG and PG. So you have been a teacher, a mentor, philosopher, friend, a guide to several students. So I must say that you are very popular amongst the student clan, even till date, no doubt about it. So what is your secret? How are you so famous?
I'm famous. Yeah, one thing I'm famous for strict teacher, a
True.
disciplined one, because that is the first thing. If you ask anybody, that will come out. But then, fine. Yeah, discipline is a most important part of your life because it. I think it work. I mean, it gives you a long-term success because if you can be a discipline in the time management, discipline in attending your routine work, whatever it is, it's going to help you in a long term. So just recently when the Teachers Day was there and my WhatsApp was pouring with the messages, and I got the messages from the, as you say, some of the very uh, old students who, that was the feeling. I as a personally as a teacher, you feel very happy that the students still remember you, and they wrote to me that yes, they are, this is what you feel. I think that is the most appreciation, or what you say, the most beautiful gift from a student to a teacher, when your student remember you, that you were a good mentor, or maybe you have somewhere touched their life, or where somewhere you have enlightened them, or you have motivated them, or you have inspired them,
Yes.
because that's the loveliest, I think that is the most happiest moment in your life.
Yes.
So
Actually, we have a few
when you
pictures
get
of
these
you and
messages,
your
it
students
feels
also.
really happy. Yeah, wow, lovely. So this is our, where we had done the World Heart Day, and I never thought I will be able to walk. I think Rucha, you and Prajakta, if you remember, I told you before that I may not be able to complete this walk, but yes, with the zest from the student, we walked. How you remember how much it was? 3.5 or something
Yeah, around, yes, yes,
kilometer.
more than
Yeah.
3 kilometers.
Yes, and that was the when you are with these young students, you also feel young. Maybe you're becoming old, but they make you feel young. So yes, that was the loveliest moment, and wow, this is what we are doing it. So that's what I say, that when you are working with the lively people, and we have all these different celebrations, and that makes you lively, makes you young, and that's the best thing. When your students go, Dipali, when she got the first rank in physiotherapy, this is the moment where she was given a certificate and a medal. So, you feel so happy that your student in the field of cardiorespiratory stood first. And the appreciation of the students, when the students gets an award or appreciation, you as a teacher also, or as a mentor also, feel happy.
Yes.
So their passing or their success is yours, and their failure is also yours, because when a student do not I mean, they do not get from that, what you say, they fail, or they do not get that good marks, you always start analyzing where you have gone wrong in giving them. You always feel bad that somewhere you have not been able to give your best to that person. Maybe that's the failure of yours. So their success is yours, and failure is also yours. That's how it comes.
You spoke so passionately about both the clinical experiences and, of course, guiding your students also. So, tell us a little bit about how you are as a person outside the hospital or outside the college.
I think I'm the same, what I'm inside and what I'm outside. So I would like to ask Rucha the same question. What do you think when I'm in the college, and when we are not in the college and we meet outside? I think I'm the same. Uh, I'm very punctual about everything. I'm a pre-planner, whether planning the academic calendar for the college or planning something at home. I do. I'm a pre-planner. I'm very punctual about everything. And I think what I am at home, I'm same at the place of work. And that's what I say, that when maybe I'm in a strict, maybe I like discipline, but at the same time, I feel that the students, I never have I've never differentiated them. What they are, they are. We are the mentor. We have to really guide them. We have to guide them when they are mentally not feeling well, when they are depressed. We have to overcome, take them into, and we have to overcome that also. So it's when sometimes, many times, the students, when I'm mentoring, I tell them that fine. you are all like my child, my children. I say I would behave the same way with my child. So it's same. I want to inculcate that discipline, punctuality in them. That's the what my main thing is. And yes, I always, when I was mentoring them, when they come to me with their problem, they come to me that how to study. I always give them the make a plan. When you are planning, when you put a time, you know how to study because each topic needs a certain time. So how to plan out and all. So when you are a good planner, when you are good to the same flow, if you are flowing, you will never be behind. You have to be with the time flow, and that's what even I feel that what I had studied in. If you go back in the from 76 to 81. And today, what we have, the physiotherapy is completely different. So you have to survive. It's like a survival of fittest. So you want to survive, you have to keep up with the education, with the new techniques, new learning. So the learning should not stop anytime. You have to learn. I have learned, being a cardiorespiratory, I have learned Mulligan, I have learned Carlton Bond, or all that thing. So you have to learn to keep it up. And that's how you can survive in this world of physiotherapy because you cannot just give passive movement.
Right. So, ma'am, just before we conclude, one last question for you. Now, being a physiotherapist, we say that it is equally important for us to take care of ourselves, right? So, what advice would you give to us physiotherapists and to future therapists in terms of how should we think of our own health as well while we are
Most
pursuing
important because being a physiotherapist, you need a strength because you may have to lift up your patient. Sometimes the whole body weight of the patient comes on you. Maybe you have to take them out of the bed. So your fitness is also very important, not physical fitness. I'm not talking about the strength and the power. Yes, that you need to take care of your patient. Otherwise, with the patient, you will fall. But other is your immunity, because as we said, we are exposed to so much of infection when we are working with a different patients in a different wards we give. So immunity is also very important, and hence we have to boost up our immunity. At the same time, mental health is also important. In today's world, everyone is under the stress. Everyone. Teachers are also under the stress. Students are also under the stress. So we all work under the stress. But that stress also we have to take positively. So you have to de-stress yourself. Have physical and mental fitness, mental health is the most important part. So we have to take care of ourselves in part of physical exercise, mental to de-stress ourselves, and to boost our immunity. So again, I would say a proper diet is most important because young generation, they they are not very they don't take a nutritious food, I would say. They may be concerned with their diet in the sense of, not becoming obese or, reducing the fat. But a proper nutritional diet is very important to boost your immunity. It should be a balanced diet because nowadays, how people survive on the fast food. And we know that fast food is not so nutritious. So that's my advice, that please take a proper care of your diet and your health, physical health and mental health. Mental health, again, I would say that everyone has their mentor. Your mentor could be your teacher, your mentor could be your friend, your parents, somebody in your family. Always speak out. Do not keep things inside, because there is something, everyone has something other inside. Once you speak out, somebody can help you. Unless and until you don't speak out, people cannot help. So please speak out. Whatever issue you have, go to the person whom you have a confidence and speak out. Maybe if that person is unable to help, she may or he may guide you. We have, there's no need, there is no hiding to take even a psychologist help, clinical psychologist. So taking care of yourself is the most important. To be a physiotherapist, a physiotherapist has to be strong physically, mentally, also.
Okay, thank you so much for your insights and for helping our viewers understand how exactly your experiences have been ever since you started your journey in physiotherapy and, of course, till date. Um, I am very happy to have had the opportunity to interview you today, and we are privileged that you were able to be a part of our Road Less Traveled series. So thank you once again, Dr. Nagarwala, for your time and contribution. And I hope to stay in touch with you in the future. Wishing you lots of love and strength and good wishes for your post-retirement. And yes, thank you once again.
Thank you, Rucha. Thank you so much for reviving my memories also with my old days, bringing it in front of me. It was like a film rolling out. Thank you so much. Thank you very much. I'm always thankful to Sancheti Institute, all the members of the Sancheti family. Thank you very much.
Thank you. So here we conclude with our session today of Road Less Traveled with Dr. Raziya Nagarwala. And I would like to conclude here. Thank you once again to team of PhysioTV and of course everyone here at Sancheti Institute College of Physiotherapy, Pune. We will see you once again in another such similar session in the future. So this is Dr. Rucha saying goodbye and take care everyone. Thank you.